What's that graph meme? 18.9% of you aren't subscribed. Subscribe, it's free. Alright.
You said what percent now? What? Are you kidding me? Subscribe. Right now. Now. You're making me jealous of Felix. Hey, I know that woman. Full disclosure, I have watched this whole series. So, I might know her from there. But I think I know her from somewhere else. Wait, we're supposed to go like this for copyright reasons, right? My bad, my bad. Do we need music in the background? I think we do need music in the background because House isn't always going to provide us with some music. They're not contractually obligated to give us music when I'm talking. Alright, back to the show.
Good morning, guys. Everybody's in their seat? You should never keep anything from your parents. And I told mine, cut the...
Is R.I. had a stroke having a field day right now?
See? We know that word, the.
First seizure 1 month ago, lost the ability to speak, babbled like a baby, progressive deterioration of mental status.
Oh, I've missed the show. It's so good.
See that? They all assume that I'm impatient because of this cane.
So put on a white coat like the rest of us.
I want him to think I'm a doctor.
You see where the administration might have a problem with that attitude.
People don't want a sick doctor.
That's fair enough. I don't like healthy patients.
Sometimes I don't wear a white coat as well, but for different reasons. You see, we're always changing spots, right? So I'm always new to a place, and I barely know the place. So people keep asking me directions, and when I say I don't know, they get annoyed with me as if I'm trying to, like, I don't know, ignore them. But I'm not. I just don't know. So if you don't wear the white coat, nobody asks you a question, and you're fine.
The 29-year-old female.
One who can't talk, I like that part.
She's my cousin.
Oh,
And your
didn't know
cousin
that.
Doesn't like the diagnosis. I wouldn't either. Brain tumor. She's gonna die. Boring.
Boring. Cancer's boring, remember?
Your sister-
Wow! Do you see that symmetricity?
Brain tumors at her age are highly unlikely.
She's 29. Whatever she's got is highly unlikely.
I like that though. She's 29. Whatever she's got is highly unlikely. That's a great answer, isn't it?
9. Whatever she's got is highly unlikely.
Shouldn't we be speaking to the patient before we start diagnosing?
What do
Is she a
you...
doctor?
No, but
Everybody.
She a doctor? Are you like just getting to know who House?
Dr. House doesn't like dealing with patients.
isn't treating patients why we became doctors?
No, treating illnesses is why we became doctors. Treating patients is what makes most doctors miserable.
This is like the exact opposite of what everybody says, so it's kind of funny. Everyone's like, we don't treat illnesses, we don't treat lab values, we treat patients, okay? It's all one. And here's this guy telling us the complete opposite. Is he right? Is what treating patients make everyone miserable? Probably not. Probably like the work hours and conditions and everyone around them would be a bigger factor, I'd say.
I don't think it's a tumor.
First year medical school, if you hear hoofbeats, you think horses, not zebras.
Are you in first year medical school?
Oof.
No. Differential diagnosis, people. If it's not a tumor, what are the suspects? Why couldn't she talk?
Aneurysm, stroke, or some other ischemic syndrome.
Get her a contrast MRI.
Creutzfeldt-Jakob disease?
Ischemic means no blood flow. So if you have a stroke and the blood flow's cut off, the brain tissue around it is going to be ischemic. And then it's not going to work because you need blood flow if you're going to work.
Mad cow. Mad zebra.
I was expecting you in my office 20 minutes ago.
Really? Well, that's odd, because I had no intention of being in your office 20 minutes ago.
We have nothing to talk about.
No, just can't think of anything I'd be interested in.
You're
Sometimes I miss the aisle.
6 years behind on your obligations to this clinic.
I was right. This doesn't interest me.
6 years times 3 weeks.
years?
Only better than...
I'm going home.
To what?
Ooh.
Nice.
Ooh. Why I gotta do him like that?
The clinic is part of your job. I want you to do your job.
But as the philosopher Jagger once said, you can't always get what you want.
Right. But if you try sometimes.
We inject gadolinium into a vein. It distributes itself throughout your brain and acts as a contrast material for the magnetic resonance imager.
Basically, whatever's in your head lights up like a Christmas tree.
Hey, Dr. Mo. Love this idea of a real doctor reacting to a medical show. Yeah, it wasn't mine. Definitely wasn't my idea, but thanks. I'm glad you love the concept. Hopefully you love the execution as well. Nobody cared who I was till I put on the mask. That's not funny anymore since literally everyone in the world now wears a mask.
I know you may feel a little claustrophobic in
Like
there,
this
but
one?
we need you to remain still.
Does everyone wear a hairnet? I have a hairnet.
Okay, we're gonna begin.
I got arrested. What about you?
I just love to help people. I don't feel so good.
It's alright, just try to relax.
I don't feel so good. It's alright. It's alright, that's normal. You're not supposed to feel good. This is how I go into surgery. Wait, what? Oh no, her throat closed. Yeah, looks great. Alright. That's enough funny business. Now it's time to be serious. The woman is dying. It's not cool. It's not cool.
Get her out of there.
She probably fell asleep. She's exhausted.
She was claustrophobic 30 seconds ago. She's not sleeping. We gotta get her out of there.
Just be another minute.
She's having an allergic reaction to the gadolinium. She'll be dead in 2 minutes.
Well, that means you have 1 more minute to spare even after that. A tracheostomy on episode 1? That was fast.
Good call.
He gave her props. That's pretty nice.
Can't get a picture. I have to get 1,000 words.
You actually want me to talk to the patient? Get a history?
We need to know if there's some genetic or environmental cause that's triggering an inflammatory.
Wait, why not try again? I mean, the gadolinium's in there, right? She's just trached. So why not just push her back in there? Tell her to ventilate herself.
Truth begins in lies. Think about it.
Think about it. That was very
That
deep.
doesn't mean anything.
No, but think about it. No, think about it.
1252.
I grew my hair. I grew my beard. No, it grew up by itself. I didn't do anything. I just said, hey, do your thing. And they decided to grow.
Patient
Journal
is
of Medicine.
orange.
I mean yellow. It's jaundice.
I mean orange.
Well, how orange? It's probably...
Exam room 1.
Addison's disease. Donald Trump disease.
Unfortunately, you have a deeper problem. Your wife is having an affair.
What?
You're orange, you moron. It's one thing for you not to notice, but if your wife hasn't picked up on the fact that her husband has changed colors, she's just not paying attention. By the way, do you consume just a ridiculous amount of carrots and megadose vitamins? Carrots turn you yellow, the niacin turns you red. Find some figure paint and do the math. And get a good lawyer. But the steroids...
He's going.
Steroids stop the inflammation. More often this happens.
What? More often this happens what?
Forget it. If you don't trust steroids, you shouldn't trust doctors. Give her steroids. High doses of prednisone.
So mysterious. Is that him? Is that the fabled Dr. House?
I know. I have no reason to think that it's vasculitis, except that it could be.
Can't diagnose that without a biopsy.
Yes, we can. We treat it. If she gets better, we know we're right.
And if we're wrong?
We'll learn something else.
Either you win or you learn. That's how we practice medicine.
What about work? You must have friends from work.
Pretty much everybody I like is 5 years old.
That doesn't sound great, does it? Now you want to know what Moist Critical was saying about vets? Honestly, I didn't watch the full video. It was something titled like, "We need to talk." He was saying, as you guys may know... Wait, I'll do my impression. As you guys may know, my girlfriend is a vet, and she tells some crazy stories like a helicopter crash happened and then we need to save the dog and we did emergency surgery. But some families don't have the money to do that type of surgery. And then I closed the video. That was the basic gist of what happened.
We learn something else.
You learn something new every day when you give patients steroids that don't need it, possibly.
We're just trying some alternative medication.
Steroids aren't an alternative to radiation.
Why doesn't he just tell her? That's weird. Just some alternative stuff. We're just trying out stuff. Just stuff for your tumor.
Really conclusive.
We're treating you for vasculitis.
Thank
blood
you.
vessels in the brain.
We think it might be that. That's why we're gonna try that. Alright, cool. Let's do this.
But it's not a tumor.
We don't know.
I don't have a tumor.
I don't know. Someone must have used the uppest channel points and gave him 10 push-ups.
Why are you smelling Billy's pants?
I'm not. I was smelling the floor.
Oh,
Do you have any pets in this class? I'm smelling for mold.
you could smell a parrot.
What does mold smell like, by the way? I actually don't know it.
You said you didn't have any pets in this class.
A parrot is a bird.
Parrots are the primary source of...
There's a bird. Chat. Is this guy supposed to be a smart doctor? It looks kind of dumb.
Parrots are the primary source of psittacosis.
It's not the parrot. How many kids were in the class?
20?
How many are homesick?
None, but...
None. But you figured that 5-year-olds are more serious about bird hygiene than their teacher.
Wait, so why go to this school at all? It's like, wouldn't mold affect the kids as well? That's the soap opera your mom watches? Really? That's interesting.
How many are...
I can go up to her room tomorrow morning and ask her for the key.
Would the police call for permission before dropping by to check out a crime scene?
It's not a crime scene.
Running a meth lab out of her basement.
She's a kindergarten teacher.
If I were a kindergarten
What?
student, I would trust her implicitly.
What is this logic? House, you're supposed to be a smart dude. What was that analogy? A crime scene? Do the police ask permission? I mean, what?
I'll give you a for instance. The lady back there.
Ew.
Made your egg salad sandwich. Her eyes look glassy. Did you notice that? Now, hospital policy is to stay home if you're sick. If you're making $8 an hour, then you kind of need the $8 an hour, right? The sign in the bathroom says that employees must wash after using the facilities, but I figured that somebody who wipes snot on a sleeve isn't hyper concerned about sanitary conditions. So what do you think?
That wasn't on a sleeve. Wait, what did I do? That wasn't on a sleeve, by the way. That was on the glove and was also disgusting. Look at that. That is literally on the glove. I would very much prefer that she use their sleeve as I'm watching House. Is it lupus? Maybe this time. Maybe this time it's lupus. We'll see, I guess.
Nobody knows anything. Now then, how is it you always think you're right?
I don't. I just find it hard to operate on the opposite assumption.
Bro! That's so good. I like that line.
How is it you always think you're right?
I don't. I just find it hard to operate on the opposite assumption. Why are you so afraid of making a mistake?
Because I'm a doctor. Because when we make mistakes, people die.
Come on.
Not always.
People used to have more respect for cripples, you know.
Nice.
They didn't really.
I did. This is why I love it. It's never lupus. You never know, though. There was a massive dilemma. What do you guys say? After Germany was defeated about if we should use the studies by Nazi doctors. Well, why would we not use them? I mean, they're already done, right? How could we not use them? Are you just gonna pretend like you never heard it? Oh, no. The data was immorally obtained. Yeah, but the data is still... It's still sound data, right? Is it like we're encouraging people to do it again? Not really. I don't know. Like, wouldn't it be unethical to not use data that could help people just because people got hurt in the process of obtaining that data? That would also mean they got hurt for no reason, kind of. Not really. But, you know, they were already hurt for no reason. But still, you get what I mean. If we found a treatment with immorally obtained information, well, then we have a treatment now. We should use it, right? It's more does the ends... It doesn't justify the means. We're not debating that, though. We already have the ends. It's like, who cares about the means if we have the ends already? We're not debating should they have done that. We're debating we have this right here. Why not use it? Just because they made a mistake and were evil. Like, we're not complicit in that.
He's your friend, huh?
Yeah.
Something like that.
Does he care about you?
I think so.
You don't know?
As Dr. House likes to say, everybody lies.
It's not what people say. It's what they do.
Yeah. He cares about me.
Wait, what?
I can't.
Is that the conclusion you came to?
He cares about me.
What? What do you mean, who cares about? Does Dr. House care about you? I don't know. He could be lying when he says he does. Yeah, but what does he do to show you he cares? Who cares about him? I don't get it. Who was that actress and what was she in? That's what I'm saying! I know her! I know her from somewhere.
I can't see.
I can't see.
I can't see.
Why are you looking up if you can't see? Okay. That was kind of scary. Not gonna lie. Is it Halloween? Wait, did she just die? Does she need an exorcist? That's what I'm saying.
We needed to shock you to get your heart going.
I kind of rambled on stream, so I decided to do a second take, you know, condense everything. So correct me if I'm wrong, but it looked like the patient went from ST segment elevation, which denotes injury to the heart, to ventricular tachycardia, to asystole within a matter of 7 seconds. Now, I'm no cardiology expert, but that seems a bit fast. I don't know. And then in the end, the patient was in asystole, which means no electrical activity in the heart. That isn't shockable, as we discussed long and hard on the stream, but I didn't consider back then that they didn't show us what they were shocking, so it could have went back to a shockable rhythm. And I think that's about it. Back to the show. Dr. Mo, I think I know what is it. Demons! Yeah, you're probably right. It's close enough to Halloween. They probably haven't, you know, gone back to the shadows yet.
She couldn't put them in order.
She should call for a consult from her 5-year-old.
No, I gave her the same test 5 minutes later. She did just fine. The altered mental status is intermittent, just like the verbal skills.
So what now?
Her verbal
Symptoms
skills?
is clearly growing deeper into the brainstem. Soon she won't be able to walk. She'll go blind permanently, and then the respiratory center will fail.
How long do we have?
If it's a tumor, we're talking a month or two. If it's infectious, a few weeks. If it's vascular, that'll probably be fastest of all. Maybe a week.
We're gonna stumble treatment.
See what's up.
Yeah. We're gonna watch her die.
And then stop her at the last second.
Watch how fast she's dying. You just told us. Each diagnosis has its own time frame. When we see how fast it's killing her, we'll know what it is.
There's gotta be something we can do.
There's nothing you can do now. You don't know.
I got nothing. How about you? You idiot! You said you didn't find anything.
Everything I found was in
You
my...
found ham. Where there's ham, there's pork. Where there's pork, there's neurocystis. Tapeworm fits.
Why is that an idiot? You could have just assumed that she was eating ham.
Mr. Neurologist, what happens when you give steroids to a person who has a tapeworm?
They
Uh-oh.
get a little better and
Then get worse.
In a typical case, you don't cook pork well enough, you digest live tapeworm larvae. They got these little hooks, they grab onto your bowel, they live, they go...
He didn't, Foreman didn't cook the pork and he ate it. Oh no! He's gonna die as well.
They reproduce.
There's only one lesion and it's nowhere near her bowel.
That's because this is not a typical case. Worm builds a wall, uses secretions to shut down the body's immune response and control fluid flow.
as long as it's healthy. So what do? Call it back. Nurse the little guy back to health.
It's too late for that. It's dying.
Call of it! Nurse the little guy back to health, call of it!
And as it dies, the immune system wakes up and attacks the worm, and everything starts to swell, and that is very bad for the brain.
It could still be 100 other things.
It fits. It's perfect. It explains everything.
But it proves nothing.
I can prove it by treating.
No, you can't.
My
I was
patient.
just with her. She doesn't want any more treatments. She doesn't want any more experiments. She wants to go home and die.
Right. Now House goes to talk with her and it's all magical. And then he learns a lesson. Sometimes you have to talk with the patient.
I'm Dr. House.
It's good to meet you.
You're being an idiot. You have a tapeworm in your brain. It's not pleasant, but if we don't do anything, you'll be dead by the weekend.
Have you actually seen the worm?
When you're all better, I'll show you my diplomas.
You were sure I had vasculitis, too. Now I can't walk and I'm wearing a diaper. What's this treatment gonna do for me?
You think steroids put you in a diaper?
No treatment.
Maybe we can get a court order, override her wishes, claim she doesn't have the capacity to make this decision.
But she does.
He's not going to do it. She's not just a file to him anymore. He respects her.
I solved the case. My work is done. Patients always want proof. We're not making cars here. We don't get
Pesky patients always wanting proof. for the fourth experimental treatment that I'm giving them.
guarantees.
I think we can prove it's a worm. Have you ever seen a worm under an X-ray?
Same thing as a CT scan, which we did, which proved nothing.
Worm cyst is the same density as the cerebrospinal fluid. We're not going to see anything in her head.
What?
He's right. We should X-ray her, but we don't X-ray her brain. We X-ray her leg.
Yay!
Or her thigh muscle. She's got one in her head. I guarantee you, there's one in her leg.
Ladies and gentlemen, we got him. Hello there, little guy.
This here is a worm larva.
So if it's in my leg, it's in my brain?
Are you looking for a guarantee? It's good news.
What do we do now?
Now we get you better. Albendazole.
2 pills.
Yeah.
Why did you hire me?
Does it matter?
Kind of hard to work for a guy who doesn't respect you.
Why?
Is that rhetorical?
No, it just seems that way because you can't think of an answer. Does it make a difference what I think?
That was... You know what? I'm gonna use that in my daily life.
Kind of hard to work for a guy who doesn't respect you.
Why?
Is that rhetorical?
No, it just seems that way because you can't think of an answer.
That's awesome! Is that not great? I love the writing. Just seems that way because you can't think of an answer.
I wanted to thank Dr. House, but he never visited again.
He cured you. You didn't cure him. Okay.
That was... I mean, I get what she was saying, but that made it seem like, what did you do to him that he would visit you? You're supposed to go visit him. That's kind of how it came off, but it was actually just, he's stupid. You can't cure stupid. Something like that.
I want a hug and a kiss from every single one of you. Get up there right now.
Yeah, maybe don't do that.
Hold on.
Oh, I remember this scene.
Why do we do this?
Because we're doctors.
Yeah, this.
If we make mistakes, we will die.
Turns out Cuddy watches the same soap opera.
You have a picture.
Am I gonna get the MC8 now? But if you try sometimes, you'll find you can watch it. Notice that house episode was watched live on stream. were you there? Would you have liked to be there? Well, follow me on Twitch, please. Fun times ahead.